Caffeine is a powerful central nervous system stimulant, and excessive consumption can lead to catastrophic health consequences, including arrhythmias, cardiac arrest, seizures, and even death. One of the most prominent examples is the case of a 24-year-old man from the UK who took a lethal dose of caffeine in an attempt to boost his energy before an important event. He drank 6 cans of energy drinks and several cups of strong coffee over the course of several hours. As a result, his heart stopped beating and he died on the spot. The case was scrutinized by medical experts who concluded that the caffeine overdose had caused him atrial fibrillation, a life-threatening heart rhythm disorder. No less terrible is the case of a girl from the United States who drank several cups of coffee in an attempt to stay awake before an exam. A few hours later, she began to have severe seizures caused by a caffeine overdose. Doctors determined that her body had been overloaded with caffeine, resulting in electrolyte imbalances and an overactive nervous system. Despite emergency medical attention, her condition remained critical for several days, until her body was able to cope with the effects of the overdose. Scientific studies confirm that consuming more than 400 milligrams of caffeine per day can cause serious heart problems, especially in people who are already predisposed to cardiovascular disease. Caffeine can increase adrenaline levels in the blood, which leads to vasoconstriction and an increase in heart rate. This puts dangerous strain on the heart and can trigger a heart attack or stroke, even in young and healthy people. Many people don't realize that caffeine is not only found in coffee, but also in many other foods. Energy drinks, black and green tea, chocolate, and some medications such as painkillers and weight loss drugs. Thus, a person can easily exceed the safe dose without even realizing it. In one study published in the journal Mayo Clinic Proceedings, doctors examined the effects of caffeine on a group of patients with cardiovascular disease. They found that patients who regularly consumed more than 400 milligrams of caffeine per day had twice the risk of arrhythmias and hypertension than those who limited their caffeine intake. Thank you. In addition to cardiovascular problems, caffeine overdose can cause seizures, which is a result of its stimulating effects on the brain. In cases of severe overdose, the seizures can be so intense that the person loses consciousness and control of their body. This can lead to dangerous situations such as falls, head injuries, and even coma. It is important to note that even if a person does not drink a lethal dose of caffeine at one time, regular consumption of large doses can cause serious health damage. The gradual accumulation of caffeine in the body leads to chronic fatigue, irritability, insomnia, and anxiety disorders. As a result, a person gets into a vicious circle, trying to overcome fatigue with new doses of caffeine, which only exacerbates the problem. Mistake 2. Mixing coffee with energy drinks or stimulants is one of the most dangerous combinations that can lead to serious health consequences. Energy drinks and stimulants such as guarana, taurine, or ephedrine contain high doses of caffeine and other substances that enhance its effects. When these products are mixed with coffee, caffeine levels in the body increase many times over, posing a real risk of overdose. An example is the case of a 19-year-old athlete from the UK who drank several cans of energy drink and then added several more cups of coffee before a competition. As a result, he experienced tachycardia and a sharp rise in blood pressure, leading to hospitalization with a diagnosis of acute heart failure. Doctors detected high levels of caffeine in his blood, which turned out to be lethal. Fortunately, the young man was saved, but this case was an example of how easily a dangerous line can be crossed. A study published in the Journal of the American College of Cardiology shows that combining coffee with energy drinks increases the likelihood of hypertension and acute arrhythmias by 40% compared to pure caffeine consumption. This becomes especially dangerous for people with hypertension and latent cardiovascular disease. Additionally, a 2018 study by scientists from the University of South Australia found that the combination of coffee and energy drinks dramatically increases the risk of seizures. They found that this explosive cocktail activates receptors in the central nervous system, causing nervous overexcitement and even epileptic seizures in some people. For example, a case in the U.S., where a 23-year-old student began suffering from uncontrollable seizures due to regular consumption of coffee and energy drinks, resulting in nerve tissue damage and serious health problems. Cases like this emphasize the importance of a conscious approach to stimulant consumption. Many people think that the combination of coffee and energy drinks will give energy and vigor, but in practice, it leads to disastrous consequences. Mistake 3. Ignoring contraindications in cardiovascular disease. This is one of the most dangerous mistakes that can be made when drinking coffee. For people with chronic heart disease, such as hypertension, coronary heart disease, or arrhythmia, coffee can become a real threat to life. The fact is that the caffeine in coffee actively stimulates the cardiovascular system, increasing heart rate and blood pressure. Combined with pre-existing heart problems, this can be a trigger for myocardial infarction, stroke, or other acute cardiac events. Research published in the journal Circulation found that in people with cardiovascular disease, consuming more than 200 milligrams of caffeine a day, about 2 cups of coffee, can increase the risk of heart complications by 30%. One striking case involved a 56-year-old woman from the U.S. who suffered from hypertension. She drank up to 5 cups of coffee a day, despite doctors' warnings. One day, during a busy day at work, she felt a sharp pain in her chest and lost consciousness. The doctors diagnosed a myocardial infarction, which developed against the background of high blood pressure and caffeine overdose. Another study conducted by scientists from Harvard University showed that people with arrhythmia, the risk of heart attacks increases significantly with regular coffee consumption. The study analyzed 500 people with chronic cardiovascular disease and found that frequent caffeine consumption increases the likelihood of stroke by 20%. For example, a 65-year-old man from Canada who suffered from arrhythmia was hospitalized after drinking several cups of strong espresso, which caused him to have a stroke. In addition, in 2020, the American Journal of Cardiology published an article analyzing data on the effects of coffee on blood pressure. As a result, it was found that in patients with already high blood pressure, even 1 cup of coffee can cause a jump in pressure by 10-15 millimeters of mercury column, which increases the risk of hypertensive crisis. In one such case, a 60-year-old man already suffering from hypertension was on the verge of life and death, when, after several cups of coffee, he suffered a hypertensive crisis that nearly led to a stroke. It is important to realize that cardiovascular diseases require careful attitude to your health. Coffee, being a powerful stimulant, can be a trigger for severe complications. If you have heart problems, you should always consult your doctor before consuming beverages containing caffeine and should be taken in moderation. Mistake 4. Drinking coffee that is too hot is not just a habit, but a serious health risk that many people underestimate. Drinking coffee at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit, significantly increases the risk of esophageal cancer and other cancers of the digestive system. This threat has been confirmed by numerous studies that have shown a direct link between drinking very hot beverages and damage to esophageal tissue, which over time can lead to malignant neoplasms. In 2016, the International Agency for Research on Cancer, IARC, a division of the World Health Organization, listed drinking drinks that are too hot as a possible carcinogen. This decision was based on an analysis of more than 1,000 studies that demonstrated that regularly drinking beverages at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit, significantly increases the risk of esophageal cancer. In a study conducted in Iran where tea is traditionally drunk at very high temperatures, it was found that people who regularly drink very hot beverages have a 90% increased risk of esophageal cancer. One real-life case was documented in Turkey, where a 45-year-old man who was used to drinking coffee at about 70 degrees Celsius, 158 degrees Fahrenheit, began having trouble swallowing after a few years. After an examination, doctors diagnosed him with esophageal cancer, which developed due to years of exposure to hot beverages on the esophageal mucosa. This case caused a public outcry and prompted the medical community to actively discuss the effects of hot drinks on digestive health. Also worth mentioning is a study published in the journal Lancet Oncology which analyzed the habits of more than 50,000 people from South American countries where hot drinks are popular. The study found that the risk of developing esophageal cancer was significantly higher in those who drank coffee or yerba mate at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit. Scientists note that constant exposure of the esophageal mucosa to high temperatures causes chronic microtrauma, which over time can lead to cell mutations and tumor formation. It is important to note that the problem does not only affect coffee, but also other hot beverages such as tea or hot chocolate. However, coffee, as one of the most popular drinks in the world, is often consumed by people on the go when they do not have time to cool it down to a safe temperature. Many people, especially those with busy schedules, prefer to drink their coffee immediately after it is brewed without waiting for it to cool down. This may seem like a minor detail, but the consequences can be serious. To prevent the risk, it is recommended that you always let the drink cool down to no more than 60 degrees Celsius, 140 degrees Fahrenheit, before you start drinking it. It may take a few minutes, but this time can greatly reduce the likelihood of developing dangerous diseases in the future. Mistake 5. Drinking coffee when you have a peptic ulcer or gastritis is an extremely dangerous practice that can lead to serious and sometimes fatal consequences. Coffee, having acidic properties and stimulating the production of stomach acid, can aggravate the symptoms of gastritis and peptic ulcer disease by increasing the irritation of the mucous membrane of the stomach and duodenum. When a person with peptic ulcer disease or gastritis continues to consume coffee, especially on an empty stomach, it can exacerbate the disease. In particular, coffee stimulates the production of hydrochloric acid, which increases the acidity of gastric juice and provokes further irritation and damage to gastric tissue. In severe cases, this can lead to ulcer perforation, a dangerous condition in which the stomach or intestinal wall ruptures, causing acute peritonitis. If the perforation is not diagnosed and treated immediately with surgery, it can be fatal. According to research published in the journal Gastroenterology, about 20% of people with peptic ulcers who continue to consume coffee experience a recurrence of the disease. In one case, described in the medical journal Case Reports in Gastroenterology, a man in his 50s with chronic gastritis repeatedly ignored doctors' recommendations and continued to drink several cups of coffee a day. As a result, he developed an acute exacerbation of his gastritis, which developed into an ulcer with subsequent perforation. This led to the need for emergency surgery and hospitalization in the intensive care unit. Doctors noted that his condition was directly related to prolonged coffee consumption against the background of gastritis. An equally important factor is that coffee can reduce the effectiveness of drugs that are prescribed to treat ulcers and gastritis, such as proton pump inhibitors. These drugs are designed to reduce the level of acidity in the stomach, but coffee, increasing the production of acid, can level their effect, which complicates treatment and lengthens the recovery period. Coffee can also aggravate the symptoms of reflux esophagitis, which often accompanies gastritis and peptic ulcers. Reflux occurs when stomach contents back up into the esophagus, causing a burning sensation, heartburn. The caffeine in coffee relaxes the lower esophageal sphincter, which allows acid in food to enter the esophagus, increasing the burning and pain. The risk of internal bleeding during an ulcer exacerbation is another major threat associated with coffee consumption. A study published in the Journal of Internal Medicine found that peptic ulcer patients who regularly consumed coffee had a 2.5 times higher risk of developing internal bleeding than those who gave up the beverage. Internal bleeding can manifest as vomiting blood or black tarry stools, both of which require immediate medical attention. Thus, people with peptic ulcer disease or gastritis should avoid drinking coffee, especially during periods of exacerbation. The health condition requires a cautious attitude towards food and drink, and unfortunately, coffee can be a catalyst for serious complications. Mistake 6. Consuming coffee during pregnancy in large doses is a serious mistake a mom-to-be can make, which can ultimately jeopardize both her health and the life of the fetus. Caffeine penetrates the placental barrier and directly affects the developing baby's body. Its effects can be especially dangerous in high doses when a pregnant woman's metabolism of caffeine slows down, leading to a buildup of the substance. According to a study published in the American Journal of Obstetrics and Gynecology, regular consumption of more than 200 milligrams of caffeine per day, that's about 2 cups of coffee, is associated with an increased risk of miscarriage and preterm labor. One large study from Denmark found that women who consumed more than 4 cups of coffee daily were 37% more likely to miscarry compared to those who avoided caffeine during pregnancy. The main problem is that the fetus's body cannot process caffeine efficiently because its liver and kidneys are still in the developmental stage. This causes caffeine to circulate in the fetus's blood much longer than in the mother's blood, which can cause cell damage, stunted growth, and problems with nervous system development. Moreover, caffeine affects the blood vessels of the placenta, which can impair blood flow and access to nutrients. A study published in the Journal of Maternal Fetal and Neonatal Medicine found that women who consumed more than 300 milligrams of caffeine per day had an increased risk of having a low birth weight baby. This condition can significantly increase the likelihood of various health problems in newborns, including immune system disorders and difficulty with thermoregulation. A real-life example may seem shocking, but it demonstrates how important it is to consider the amount of caffeine consumed. In 2018, a case was described in the UK where a woman who was used to regular coffee consumption continued to drink 4 to 5 cups a day during her pregnancy. Unfortunately, her baby was born prematurely with a number of complications related to underweight and developmental delays. Doctors noted that caffeine played a key role in the complications, making it difficult for the fetus to develop normally. In addition, studies show that high doses of caffeine can increase the risk of preeclampsia, a dangerous condition that is accompanied by high blood pressure and swelling. Consuming more than 300 milligrams of caffeine per day has also been linked to the development of gestational diabetes in some women, leading to additional pregnancy complications. Among other things, caffeine can negatively affect a pregnant woman's sleep quality, and lack of sleep and constant fatigue can exacerbate pregnancy complications and cause mental health issues. Studies show that chronic sleep deficiency in pregnant women can lead to depression and increased anxiety, which in turn affects the overall health of the mother and child. Thus, pregnant women are advised to strictly limit their caffeine intake, or eliminate it completely from their diet to minimize the risk to themselves and the unborn child. Mistake 7. Abuse of coffee in glaucoma is a mistake that can seriously affect vision and aggravate the course of the disease. Glaucoma is a chronic disease characterized by increased intraocular pressure and can lead to vision loss if left unchecked. The caffeine in coffee can increase this pressure, making it dangerous for people with glaucoma. Studies conducted by scientists from Harvard Medical School have shown that caffeine consumption in doses exceeding 200 milligrams per day, that's about 2 cups of coffee, can increase intraocular pressure by 3 millimeters of mercury column within an hour of consumption. For a healthy person, this may not be critical, but for people with glaucoma, even such a small increase can accelerate the progression of the disease and affect vision. Coffee abuse is especially dangerous in the case of open-angle glaucoma, which is often asymptomatic in its early stages. Patients may not notice vision changes until damage to the optic nerve becomes severe. High intraocular pressure caused by caffeine can imperceptibly deteriorate the nerve and contribute to loss of peripheral vision. There's an interesting case study described in a medical journal. A 58-year-old man suffering from glaucoma was unaware of the effects of coffee on his vision and regularly drank 4 to 5 cups of coffee a day. Despite following medical advice and taking medication to control intraocular pressure, his condition worsened. After further investigations, it was found that his coffee habit was the main cause of his intraocular pressure spikes. Only after significantly reducing his coffee consumption did his condition stabilize and his vision loss slowed down. Another study published in the journal Investigative Ophthalmology and Visual Science showed that regular coffee consumption increases the risk of glaucoma in those who have a predisposition to this disease. Scientists analyzed data from more than 100,000 people and found that those who drank more than 3 cups of coffee a day had a 66% increased risk of developing glaucoma compared to those who drank no or moderate amounts of coffee. The same study found that coffee can negatively affect ocular blood flow by reducing oxygen and nutrients to the optic nerve, increasing its degeneration. This effect is particularly pronounced in people over the age of 50, whose risk of developing glaucoma is already high. It is important to remember that glaucoma is a disease that requires constant monitoring and care. Even minor lifestyle changes, such as coffee abuse, can have a negative impact on vision. Therefore, people suffering from this disease are advised to minimize coffee consumption or give it up completely to reduce the risk of complications. Thus, moderate coffee consumption is an important aspect of eye health care for glaucoma patients. Mistake 8. Regularly drinking coffee on an empty stomach is one of the most common mistakes many coffee drinkers make. While this flavorful beverage is often thought of as a way to perk up in the morning, consuming it on an empty stomach can lead to serious gastrointestinal health consequences. Caffeine stimulates the production of stomach acid, which without food can have an aggressive effect on the gastric mucosa. When coffee enters the stomach on an empty stomach, it causes cells to produce more acid than necessary. This excess acid begins to erode the gastric mucosa, which normally protects the tissues from irritation. Studies have shown that regular consumption of coffee without food can cause gastritis, an inflammation of the mucous membrane of the stomach, which, if left untreated, can develop into an ulcer. A real-life case study published in the journal Gastroenterology is interesting. A 35-year-old woman, an office worker for several years, started the day with a cup of strong black coffee without breakfast. After a while, she began experiencing intermittent abdominal pain that worsened with each passing month. Her symptoms included heartburn, nausea, and upper abdominal pain. She eventually developed a stomach ulcer, which required treatment with acid-reducing drugs and a strict diet. Research also supports this risk. A paper published in the Journal of Clinical Gastroenterology found that people who regularly drink coffee on an empty stomach have a 30% increased risk of developing gastritis and peptic ulcers compared to those who drink coffee after meals. Scientists believe this effect is due to increased acidity as well as the effects of caffeine and other active ingredients in coffee on stomach cells. In addition, a study conducted at the University of Southern California showed that regular consumption of coffee without food increases the risk of developing acid reflux, GERD. This syndrome occurs when stomach acid backs up into the esophagus, causing burning and inflammation. In the long term, this can lead to the development of chronic inflammation and even precancerous conditions in the lower esophagus. A case described in the medical literature concerns a man of 45 years of age who began each day with 3 cups of coffee on an empty stomach. After several years of this habit, he developed severe gastritis and had to undergo an operation to remove the part of his stomach affected by erosions and ulcers. This case emphasizes that the abuse of coffee on an empty stomach can have fatal consequences. Moreover, coffee without food can have negative effects on the nervous system. People who drink coffee on an empty stomach are more likely to complain of anxiety, nervousness, and even tremors. Notes this is because caffeine without food is absorbed more quickly into the bloodstream, causing a sharp increase in adrenaline and cortisol levels, stress hormones. This can lead to nervous disorders such as anxiety and panic attacks, especially in caffeine-sensitive people. Thus, regularly consuming coffee on an empty stomach poses serious health risks, especially for those who are already prone to stomach problems. The best way to minimize these risks is to consume coffee only after meals to protect the gastric mucosa and prevent serious complications. Mistake 9. Consuming coffee for chronic insomnia is one of those fatal mistakes that can slowly destroy a person's nervous system and mental health. Caffeine is a powerful stimulant that affects the central nervous system, increasing alertness and activity levels. Please, however, for people who suffer from chronic insomnia, this effect can be devastating, causing serious neurological and mental health problems. When a person suffering from insomnia continues to consume coffee, they are caught in a vicious cycle. Caffeine causes arousal, which prevents normal sleep, and lack of sleep leads to an even greater desire to consume coffee to maintain energy. A study published in the Journal of Sleep Research found that regular coffee consumption in people with insomnia increases the risk of developing anxiety disorders by 30% and depression by 25%. Over time, constant stimulation of the nervous system leads to its exhaustion. One real-life case was described in the American Journal of Psychiatry. A young woman of 32 worked in a law firm and consumed up to 6 cups of coffee daily to cope with sleep deprivation due to chronic insomnia. For several years, she experienced nervous exhaustion, but continued to consume coffee despite clear signs that her mental health was deteriorating. Eventually, her anxiety disorders developed into severe depression that required hospitalization. Doctors note that excessive caffeine consumption exacerbated her condition and led to a nervous breakdown. Insomnia not only impairs cognitive functions such as attention, memory, and decision-making, but also affects a person's emotional state. Research conducted at Stanford University shows that people with chronic insomnia who continue to consume coffee are 40% more likely to experience symptoms of depression and 20% more likely to experience suicidal thoughts compared to those who give up caffeine. In addition to neurological effects, regular coffee consumption for insomnia can lead to physiological problems. Inadequate sleep disrupts the regulation of cortisol, the stress hormone, which leads to chronic fatigue and exhaustion. This, in turn, causes the body to seek additional sources of energy, provoking further coffee consumption and worsening the state of the nervous system. Researchers from Harvard University have found that people who regularly consume coffee in conditions of chronic insomnia are at greater risk of developing cardiovascular disease. Lack of sleep and constant nervous system arousal increase blood pressure and cortisol levels, which significantly increases the risk of heart attacks and strokes. Long-term consequences can include hypertension, heart failure, and other serious heart abnormalities. In real life, there are often stories of excessive coffee consumption leading to emotional exhaustion and depressive states. One such case is described in the clinical report of a British psychiatrist. A patient suffering from chronic insomnia experienced constant panic and anxiety attacks despite regular therapy. When she was found to be a heavy daily coffee drinker, caffeine withdrawal became a key element of her treatment. After 3 months without coffee, her condition improved significantly, her anxiety decreased, and her insomnia became less severe. Thus, drinking coffee for chronic insomnia can be a dangerous mistake that not only worsens insomnia but also has a devastating effect on the nervous system, increasing the risk of depression, anxiety disorders, and even suicidal tendencies. Mistake 10. Combining coffee and alcohol is a hidden danger that is often underestimated. Many people believe that having a cup of strong coffee after drinking alcohol helps with alcohol intoxication, but this is a dangerous misconception. Instead of reducing the effects of alcohol, coffee only masks the symptoms, making the situation even more risky. Caffeine and alcohol act differently on the body. Caffeine is a stimulant that increases central nervous system activity, increases heart rate, and raises blood pressure. Alcohol, on the other hand, acts as a depressant, relaxing muscles, and slowing brain function. When these two substances mix, the body receives conflicting signals, which can cause a number of negative effects. A 2016 study by scientists at Brown University found that coffee can mask the effects of alcohol intoxication, making a person feel more awake than they actually are. This creates the illusion of sobriety, which often leads to dangerous decisions such as drunk driving or continuing to drink alcohol until intoxication sets in. Statistics show that up to 50% of accidents involving drunk drivers are precisely because of the false sense of sobriety induced by caffeinated beverages. In addition, regular mixing of coffee and alcohol causes a serious blow to the liver. Alcohol itself is already a toxin to the liver, and its constant consumption can lead to the development of diseases such as fatty liver degeneration, hepatitis, and even cirrhosis. Caffeine, while not toxic to the liver in moderate amounts, when combined with alcohol can increase the burden on this organ, impairing its regenerative abilities. Researchers from Harvard Medical School found that people who regularly mix coffee and alcohol have a 30% increased risk of developing liver disease compared to those who avoid the combination. One illustrative case is the story of a 28-year-old man from the U.S. who was hospitalized with acute alcohol intoxication after a party where he mixed alcohol with energy drinks containing caffeine. Doctors noted that the caffeine not only masked his intoxicated state but also worsened his liver condition, requiring multiple days of hospital treatment. Another major concern is the effect on the cardiovascular system. The combination of coffee and alcohol can lead to sudden spikes in arrhythmias. This is because coffee stimulates the heart, while alcohol, on the other hand, slows down its rhythm. These opposite effects can cause heart rhythm disturbances and lead to life-threatening conditions such as ventricular fibrillation or cardiac arrest. One study published in the Journal of the American College of Cardiology found that people who regularly consumed coffee and alcohol together had a 20% increased risk of heart attack. Regularly combining coffee and alcohol can also trigger mental disorders such as anxiety, depression, and nervousness. Caffeine increases anxiety symptoms. And alcohol, in turn, disrupts the chemical balance of the brain by suppressing the production of serotonin. This leads to emotional instability and can contribute to the development of chronic mental health disorders. In 2017, the Mayo Clinic described the story of a patient suffering from chronic anxiety and depression who regularly mixed alcohol with caffeine-containing beverages. Her condition worsened significantly, requiring long-term treatment with psychotropic drugs. Thus, combining coffee and alcohol is a dangerous mistake that can lead to a host of negative health consequences, including liver damage, heart problems, and stroke, and mental health problems. So, now that you've learned about the 10 fatal mistakes of drinking coffee, the question becomes, how do you drink coffee safely? It's all about moderation and the right approach. First, try to limit your coffee intake to 400 milligrams of caffeine per day. That's about 4 cups of regular coffee. If you have chronic conditions such as hypertension, glaucoma, or stomach problems, it's best to consult your doctor to determine your safe dose. Secondly, choose the right time for coffee. It is ideal to drink the first cup an hour after waking up, and the last cup at least 6 hours before bedtime to avoid insomnia and overstimulation of the nervous system. Also, do not drink coffee on an empty stomach. It can irritate the gastric mucosa. It is better to drink it after breakfast or as a pleasant addition to lunch. Do not forget that the quality of coffee also matters. Give preference to fresh beans, avoid excessive amounts of sugar, artificial additives, and energy drinks. Remember that coffee can be your friend if you consume it wisely. Enjoy every cup, but don't let coffee jeopardize your health. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos. Onions are a much-loved and popular superfood around the world, but did you know that eating them incorrectly can turn into a real disaster for your health? In this video, we will reveal 10 fatal mistakes with onions that can cost you your life. Mistakes that are extremely rarely talked about but can cause cancer, stroke, or even cardiac arrest. From dangerous food combinations to improper preparation, you'll be surprised how dangerous what was thought to be harmless. Watch to the end to learn how to avoid these mistakes and keep yourself healthy. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like and let's get started. Fatal mistake 1. Consuming onions with pesticides and chemicals. One of the biggest dangers is that onions contain residues of pesticides and other chemicals that are used in agriculture to protect plants from pests and diseases. Studies show that pesticides used to treat vegetables can accumulate in produce and enter the human body when consumed. According to the World Health Organization, WHO, more than 200,000 people die each year from illnesses related to exposure to pesticides and other toxic chemicals in food. Pesticides have been linked to an increased risk of various cancers, including stomach, liver, and colon cancer. One 2018 study from the Cancer Institute found that people who regularly consumed foods with high levels of pesticides were 30% more likely to develop cancer. This is because pesticides can damage cell DNA, cause mutations, and promote the formation of malignant tumors. Many farmers and consumers are unaware that using harsh chemicals to treat crops can have disastrous consequences. For example, in one case described in the journal Health Perspectives, a group of people who regularly consumed non-organic vegetables treated with pesticides showed a dramatic increase in blood toxicity levels. This led to an increase in cancer cases among this group over several years. So what can you do to keep yourself and your family safe? The answer is simple. Choose organic onions or wash them thoroughly before consumption. Organic produce is grown without the use of synthetic pesticides, which greatly reduces the risk of your body being exposed to harmful chemicals. If organic onions are not available, wash conventional onions thoroughly under running water or use a special solution to remove pesticides. You can also peel onions from the top layers of the skin, as this is where most chemicals accumulate. However, don't forget that onions are a valuable source of antioxidants and phytonutrients that help fight inflammation and protect the body from free radicals. Proper preparation of the product for consumption will allow you to preserve its benefits and avoid dangerous health consequences. Be mindful of your diet and choose your foods consciously. This will help you not only enjoy their flavor, but also protect yourself from fatal mistakes that could cost you your life. Fatal mistake 2. Overconsumption of fried onions. This culinary habit, seemingly harmless and everyday, can turn into a serious threat to your health if you don't take precautions. Fried onions are a popular ingredient in many dishes. However, when onions are fried at high temperatures, chemical changes occur that can lead to the formation of substances that are hazardous to your health. One of the most well-known carcinogens formed during frying is acrylamide. This toxin is formed when carbohydrates and proteins are processed at high temperatures, and its effects on the body can be fatal. Acrylamide was first discovered by scientists in 2002, and since then it has been the subject of numerous studies. According to the European Food Safety Authority, EFSA, acrylamide can damage the DNA of cells, which increases the risk of cancerous tumors, especially in the esophagus, pancreas, and lungs. The World Health Organization has also listed acrylamide as a potential carcinogen, highlighting its danger with long-term exposure. According to a 2015 Harvard School of Public Health study, people who regularly consumed fried foods, including fried onions, were 30% more likely to be at risk for cardiovascular disease. More than 100,000 people participated in the study, and the results confirm that acrylamide has a strong negative impact on the cardiovascular system, causing inflammation and damage to arteries. In one published story, a man who was an avid fan of fried onions added them to his meals daily. After a few years, he developed a chronic inflammatory process in his stomach, which eventually led to the development of esophageal cancer. Doctors attributed this to the accumulation of carcinogens in the body due to frequent consumption of heavily fried foods. So what can be done to avoid this fatal mistake? First, you need to minimize frying onions at high temperatures. If you like fried onions, try cooking them on medium heat and use oil with a high smoke point, such as virgin olive oil or coconut oil. This will help avoid the formation of carcinogens. Second, pay attention to the cooking method. Instead of frying, try baking onions in the oven or steaming them. This will preserve the onion's health benefits, such as vitamin, antioxidant, and phytonutrient content, without subjecting it to dangerous heat treatments. Don't forget the importance of balance in your diet. Constant consumption of fried foods increases the risk of cardiovascular disease, strokes, and cancer. Therefore, diversify your menu with fresh vegetables, steamed or oven-cooked, to reduce your health risks and continue to enjoy the taste of onions without fatal consequences. Fatal mistake 3. Combining onions with other foods that cause digestive disorders. Onions, like many other foods, have a strong effect on digestion. However, when combined with certain foods, it can cause serious gastrointestinal disorders. For example, onions eaten at the same time as legumes, dairy products, or heavy fried foods can cause bloating, nausea, and vomiting. Gas, heartburn, and even worsen symptoms of irritable bowel syndrome. Studies show that onions contain fructooligosaccharides, which, as complex carbohydrates, are poorly digested and can cause excessive gas. In 2018, a study published in the journal Gastroenterology Research and Practice showed that combining onions with fruit foods rich in fat or protein slows digestion, increasing the risk of bloating, dyspepsia, and heartburn. Researchers at the University of Oxford also studied the effects of onions on patients with irritable bowel syndrome. The research found that 60% of patients who consumed onions in combination with legumes or cabbage vegetables had significantly increased symptoms of bowel distress, including diarrhea and abdominal pain in one published story. A woman who suffered from frequent digestive upset regularly consumed onions in combination with fried foods and dairy products. Over time, her condition worsened and doctors diagnosed her with ulcerative colitis, ulcerative gastritis. After she eliminated such food combinations from her diet, her digestion improved and her gastritis symptoms disappeared. To avoid fatal consequences from the wrong combination of onions with other foods, it is important to follow simple rules. First, avoid eating onions together with foods that are difficult to digest. Fatty, fried foods, dairy products, and legumes. Onions are best combined with vegetables, greens, and foods rich in fiber. This improves its absorption and minimizes the risk of digestive disorders. Second, if you are prone to stomach problems, try to consume onions in boiled or baked form. Heat treatment softens its effects on the gastrointestinal tract and reduces the risk of irritation. Also, add more probiotics to your diet, such as kefir or yogurt with live bacteria, to support gut health and improve digestion after eating onions. Don't forget that eating healthy is not only about choosing healthy foods, but also choosing the right combination of foods. This will help you avoid digestive problems and enjoy all the health benefits of onions without health risks. Fatal mistake 4. Consumption of onions in large quantities in chronic stomach diseases. Onions have long been known for their healing properties, and many people regularly include them in their diet to boost their immune system and improve their overall health. However, for those who suffer from chronic stomach conditions, such as gastritis, peptic ulcers, or gastroesophageal reflux disease, GERD, excessive onion consumption can be disastrous for health. Studies show that in people with GERD or gastritis, onions can provoke an increase in symptoms, including heartburn, pain, and even bleeding from ulcers. A 2015 study published in the journal Digestive Diseases and Sciences found that 72% of patients with GERD had their symptoms worsened after consuming raw vegetables, such as onions and garlic. These foods help to increase acid production in the stomach, which worsen the patient's overall condition. Another study published in the American Journal of Clinical Nutrition found that regular consumption of onions can irritate the stomach in people with hyperacidity, which in the long term, can increases the risk of peptic ulcers and gastritis. One patient's story described in scientific publications demonstrates the dangers of excessive onion consumption in the presence of peptic ulcers. A man suffering from chronic gastritis liked to add large portions of onions to every meal. After several months, his condition worsened significantly. Severe stomach pains began, which led to hospitalization with a diagnosis of gastric ulcer. Doctors strongly recommended him to exclude onions from his diet and switch to a gentle diet. For people with chronic stomach disease, onion consumption should be limited and strictly monitored. Raw vegetables, especially onions, can greatly increase the irritation of the gastric mucosa, leading to poor health. First, if you have chronic gastrointestinal diseases, try to consume onions in moderation and only after heat treatment. Boiling, stewing, or baking onions greatly reduces their irritating effect on the stomach. Secondly, avoid eating onions on an empty stomach, especially raw. It is best to add onions to dishes that neutralize their offensive effects, such as soups or stewed vegetables. This will help minimize the risk of irritation and the development of serious complications. Finally, if you experience symptoms of heartburn or stomach pain after consuming onions, be sure to see your doctor and reconsider your diet. It is important to realize that even the most beneficial products can be dangerous if you do not take into account the individual characteristics of the body and existing diseases. Fatal mistake 5. Consumption of onions with circulatory problems. When we think of onions, we most often imagine them as an integral part of dishes that adds flavor and benefits to our body, but as beneficial as onions are, consuming them improperly can have disastrous consequences for people with circulatory problems. Onions have strong anticoagulant properties that can become a real life-threatening condition. Onion is known for its effect on the blood. It contains sulfur compounds and quercetin, which help reduce the risk of blood clots by making the blood less viscous. This sounds like a wonderful property, especially for preventing cardiovascular disease. However, for people who take anticoagulants or other blood-thinning medications, this can turn out to be a serious problem. Combining onions with medications such as warfarin, aspirin, or heparin can significantly increase their effects, which can eventually lead to internal bleeding and, in more severe cases, hemorrhagic strokes. According to a study published in the Journal of Clinical Nutrition in 2018, regular consumption of onions in large quantities can significantly enhance the effects of blood-thinning drugs. The study involved 200 patients with cardiovascular disease who were diagnosed with an increased risk of thrombosis. It was observed that those who ate onions in combination with anticoagulants had a higher risk of bleeding-related complications than those who excluded onions from their diet. For example, in 2017, there was a case reported in Germany where a man who suffered from thrombosis and was taking warfarin began actively adding fresh onions to his diet. A few weeks later, he was hospitalized with internal bleeding, which led to a severe condition that required emergency intervention. If you suffer from circulatory problems or are taking blood thinners, you should be especially careful with onions. This does not mean that you should completely abandon this useful product, but it is better to consult with your doctor to determine a safe dosage. In addition, it is important to keep in mind that some natural remedies, such as garlic and turmeric, also have anticoagulant properties. Combining them with onions and medications can increase the risk of bleeding. Your doctor can help you balance your diet to stay healthy and avoid negative effects. It is also advisable to avoid excessive consumption of raw vegetables with strong anticoagulant properties if you are taking blood-thinning medications. Measure and a sensible approach are key aspects of safely consuming foods like onions. Onions are indeed a powerful natural medicine, but consuming them incorrectly can turn out to be truly life-threatening. If you have circulatory problems or are taking anticoagulants, it is important to consult your doctor before adding onions to your daily diet. Fatal mistake 6. Excessive consumption of onions and liver diseases. Onions with their many health benefits can be a real health lifesaver, but as with any food, their consumption requires a sensible approach, especially in people with liver disease. Despite its rich content of antioxidants and sulfur compounds, the abuse of onions can put a serious strain on the liver and lead to deterioration of its function, especially if the organ is already weakened by chronic diseases. The sulfur compounds found in onions play an important role in antioxidant activity and detoxification of the body. However, in people with liver disease such as cirrhosis, fatty hepatosis, or hepatitis, excessive amounts of these compounds can overload the liver, which can exacerbate already existing problems. When the liver is weakened, its ability to process toxins and fats is greatly reduced. In this case, excessive consumption of onions, which are rich in sulfur-containing compounds, can trigger inflammation and worsen liver function. This can lead to an increase in symptoms of diseases such as liver failure and may require more serious medical intervention. Studies show that in people with chronic liver disease, it is important to limit the consumption of foods rich in sulfur compounds. For example, a study published in the journal Hepatology in 2019 noted that patients with cirrhosis who consumed more than 100 grams of raw onions per day showed a worsening of liver function tests such as alanine aminotransferase, ALT, and aspartate aminotransferase, AST, levels. This resulted in increased symptoms of fatigue and weakness, which required adjustments to their diet. In addition, there have been documented cases where patients with fatty hepatosis experienced a dramatic deterioration in their condition after regularly consuming large amounts of onions. This is due to the fact that the liver does not have time to process the excess sulfur-containing compounds, which causes inflammation and increased levels of fat in the organ's tissues. Let's take the case of a patient named Victor who suffered from fatty hepatosis for several years. Believing in the benefits of onions as a detoxifying agent, he began to actively incorporate them into his diet, consuming up to 150 grams of raw onions daily. After a few weeks, he began to experience severe fatigue, right subcostal pain, and noticed yellowing of his skin. After consulting a doctor and undergoing tests, it turned out that his condition had worsened due to an overload of sulfur compounds in the onions on his liver. After adjusting his diet and reducing the amount of onions he consumed, his condition began to improve. For people with liver disease, it is extremely important to control the consumption of onions and other foods rich in sulfur-containing compounds. Doctors recommend consuming onions in moderation and limiting their amount to safe limits. No more than 50 grams per day, depending on the patient's health condition. It is important to monitor your body's reaction and consult your doctor when adding this vegetable to your diet. If you have been diagnosed with liver problems, it is also important to avoid excessive consumption of other foods containing sulfur, such as garlic and broccoli, so as not to overload the liver. Fatal mistake 7. Consumption of onions for kidney disease. Onion is a vegetable with a rich history in folk medicine, and for many centuries it has been considered a universal remedy to promote health. But like any other product, onions may not be as harmless as they seem at first glance. This is especially true for people suffering from kidney disease. Imagine a person who has considered onions an integral part of his diet all his life. He adds it to soups, roasts, salads, believing that he is doing only the best for his health. But as he ages, his body begins to change, and one day he is diagnosed with chronic renal failure. What the man doesn't realize is that onions, that familiar companion to his meals, are now a potential threat. Onions, rich in potassium, become dangerous to a person with weakened kidneys. When the kidneys function normally, they efficiently filter the blood and remove excess potassium with urine. But if the kidneys fail to do this, the potassium levels in the blood begin to rise like a tidal wave that can lead to disaster. Hyperkalemia is an insidious condition where excess potassium in the blood can cause muscle weakness, irregular heartbeat, and in the most severe cases, a heart attack. Take Mary for example, a woman aged 65 who, despite her kidney problems, continued to add onions to her favorite dishes every day. She had no idea that this simple vegetable could prove dangerous to her health. One day, she began to notice strange symptoms. Her muscles began to weaken and her heart began to beat irregularly. When she went to the doctor, she learned that her blood potassium levels were at a critical level and her onion eating habit could have cost her her life. Studies show that up to 40% of people with chronic kidney failure suffer from hyperkalemia. Doctors strongly advise such patients to closely monitor their diet and avoid foods high in potassium. However, even small changes in diet may not be enough without control and regular monitoring of electrolyte levels in the blood. In addition to potassium, onions contain oxalates, substances that can increase the risk of kidney stones. And while the concentration of oxalates in onions is not as high as in spinach, for example, even small amounts can make a difference for someone with kidney dysfunction. Such stones can cause pain and infection, creating a vicious cycle of problems where an attempt to maintain health through nutrition turns into new complications. So what should you do if onions have been part of your diet for years, but now you've learned of their potential kidney threats? First of all, there's no need to panic. There is always a solution. It's important to consult with a nephrologist who can help tailor your diet to your kidney health. It may be necessary to eliminate onions or reduce the amount of onions in your diet. There are also alternatives. Vegetables with lower potassium content, such as zucchini or carrots, can be great substitutes in familiar recipes. Your challenge is to find a balance where you can enjoy a delicious and healthy meal without risking your health. Maria, whom we talked about earlier, managed to avoid tragedy by changing her eating habits in time. Under the doctor's supervision, she managed to stabilize her blood potassium levels and learned to cook new dishes that tasted as good as the ones she was used to. Her story reminds us that even the most innocuous products can be dangerous, especially if you do not take into account the peculiarities of your own body. Thus, the use of onions in kidney disease requires special attention and control. This favorite vegetable can become a serious enemy if you neglect the recommendations of specialists. However, proper nutrition and regular medical examinations will help to preserve health and avoid unpleasant consequences. Fatal mistake 8. Combining onions with diabetes medications. Onions are not only a versatile and flavorful ingredient, but also a product with powerful medical properties. It has the ability to lower blood sugar levels due to the compounds it contains, such as allicin. This effect can be very beneficial for people with high glucose levels. However, if onions are consumed in combination with anti-diabetic medications, the effects can be extremely dangerous. Taking onions along with sugar-lowering medications can lead to hypoglycemia, a condition in which blood glucose levels drop to critical levels. Hypoglycemia can manifest itself through symptoms such as sudden weakness, dizziness, sweating, rapid heartbeat, and even loss of consciousness. In some cases, hypoglycemia can lead to coma or other serious health conditions that require emergency medical attention. Research shows that these reactions are most likely to occur in people who take sugar control medications, such as metformin or insulin, in combination with large doses of onions. A 2019 study in the journal Diabetes Research and Clinical Practice highlights the risk of interactions between foods containing natural sugar-lowering ingredients and anti-diabetic medications. The study notes that simultaneous consumption of such products can enhance the effects of the medications and lead to a dramatic drop in glucose levels. To minimize the risks associated with consuming onions and anti-diabetic medications, it is important to exercise caution and follow the advice of medical professionals. If you are taking medications to control your blood sugar levels, be sure to consult your doctor before making significant changes to your diet, especially if you plan to increase your onion consumption. Your doctor may suggest adjusting the dosage of your medication or regularly monitoring your blood glucose levels to avoid dangerous fluctuations. This approach will not only help you avoid hypoglycemia, but also help you maintain an overall balance in managing your diabetes, keeping you healthy and well. Fatal mistake. 9. Allergic reactions to onions. Although onion allergies are less common than other foods, they can still pose serious health risks. Onion allergies can present with a variety of symptoms ranging from mild skin irritations to severe anaphylactic reactions that can be fatal without immediate medical attention. Allergic reactions to onions can be caused by either raw or cooked products, but they are most common when raw onions are consumed because heat treatment partially destroys the allergens. Studies show that onions contain several proteins that can trigger allergies. A 2012 study published in the journal Allergy found that 1% of participants experienced various allergic reactions to onions, such as skin rashes, swelling, itching, and even anaphylaxis. One of the most dangerous aspects of these allergies is that even the smallest amount of onions in a dish can trigger a reaction in sensitive individuals. Anaphylactic shock is the most serious manifestation of onion allergy that requires immediate medical intervention. This condition can lead to respiratory arrest and heart failure if adrenaline is not administered in time. In one reported case in Spain, a middle-aged woman allergic to onions accidentally ate a dish with a small amount of onions. Within minutes, she developed severe swelling, choking, and a drop in blood pressure. Doctors diagnosed her with anaphylactic shock, and only a surgical injection of adrenaline saved her life. For those who suspect an allergic reaction to onions, it is important to see a doctor and undergo allergy tests to accurately determine the presence and extent of the allergy. If an onion allergy is confirmed, eliminate it completely from your diet. And read food labels carefully to avoid hidden ingredients. It's also important to have epinephrine on hand, especially if you've already had anaphylactic reactions to onions or other foods. If you experience the first symptoms of allergies, such as itching, rashes, or difficulty breathing, you should seek medical attention immediately. And while onions remain an important and healthy food for most people, those who are allergic to them should be especially cautious. Neglecting allergy symptoms can lead to catastrophic, life-threatening consequences. 10. Storing sliced onions for too long. Onions are a powerful ally for health, but storing them improperly can turn into a serious hazard. One of the most common mistakes people make is storing sliced onions for too long. While onions are rich in antioxidants and beneficial compounds, they can also be a great breeding ground for bacteria, which can lead to food poisoning and even more serious illnesses, especially in immunocompromised people. Once onions are sliced, their structure is compromised, and they become more vulnerable to germs and bacteria from the environment. The moist and warm environment is especially conducive to the rapid multiplication of bacteria such as Escherichia coli, Salmonella, and Staphylococcus aureus, which can cause severe poisoning. One myth that is actively circulating is that sliced onions absorb bacteria from the air and become toxic. In fact, bacteria multiply on onions not because they suck them up from the environment, but because sliced onions provide ideal conditions for their growth. According to the Centers for Disease Control and Prevention, CDC, food poisoning affects millions of people worldwide each year. In 2021, about 48 million cases of food poisoning in the U.S. were linked to a variety of pathogens, including bacteria that can multiply on improperly stored foods, such as sliced onions. Among them, Salmonella strains are particularly dangerous and can lead to serious infections in immunocompromised people, children, and the elderly. A study published in the journal Food Microbiology in 2020 found that sliced onions stored at room temperature for more than 6 hours had a significantly increased risk of bacterial contamination. Storing sliced onions in the refrigerator reduces the risk of contamination, but even under these conditions, they should be consumed within 24 hours. Take the case of Anna, who once left sliced onions on her kitchen countertop overnight, forgetting to put them away in the refrigerator. The next day, she used those onions to make a salad. A few hours after eating it, she experienced severe abdominal pain, nausea, and diarrhea. After going to the hospital and undergoing tests, it turned out that she had contracted Salmonella bacteria that had multiplied on the leftover onions. Doctors were able to stabilize her condition, but this case was a reminder of the importance of proper food storage. To avoid similar incidents, it's important to follow simple rules for storing sliced onions. First, if you are not going to use the sliced onions right away, be sure to store them in an airtight container in the refrigerator. The storage temperature should be no higher than 4 degrees Celsius. 39.2 degrees Fahrenheit. It is advisable to consume sliced onions within 24 hours to minimize the risk of bacterial contamination. Also, avoid storing sliced onions at room temperature, especially in warm weather when bacteria multiply faster. If an onion has been sliced and stored for longer than 6 hours outside of the refrigerator, it's best not to risk it and throw it away. So, how do you properly use onions for maximum benefits and safely? Onions are a true treasure of nature that many of us use on a daily basis, without giving much thought to their underlying benefits. However, proper use of this vegetable requires attention to detail that will help you get the most out of it and avoid potential trouble. Let us guide you through a process that will help make onions your staunch ally in maintaining your health. Step 1. Choosing the right onion. Let's start with the fact that there are several varieties of onions, and each one has unique properties. Yellow onions are a classic. Their flavor is sharp, but they become sweet and mild after heat treatment. White onions are less pungent, ideal for fresh salads. Their flavor is more delicate. Red onions are characterized by their richness and are suitable for marinades. They are rich in anthocyanins, powerful antioxidants that strengthen the immune system. It is important to understand which type of onion is best for your purpose. For example, if you want to add onions to raw salads for health benefits, choose red onions. And if you plan to braise or bake it for mild flavor and to preserve its antioxidant properties, yellow onions would be a great choice. Step 2. Cooking to preserve the benefits. When it comes to cooking onions, it's important not to overheat them. Surprisingly, when cooked over low heat at about 120 degrees Celsius, 248 degrees Fahrenheit, for 10 to 20 minutes, onions retain most of their beneficial compounds. This cooking method allows the onions to reveal their sweetness and retain their valuable fiber, which promotes intestinal health. To preserve vitamins and antioxidants, try to avoid overcooking at high temperatures. Not only can this destroy the beneficial substances, but it can also lead to the formation of harmful compounds. One way to avoid this is to braise onions with a little olive oil. This will not only soften its flavor, but also enhance the absorption of fat-soluble vitamins. Step 3. Using onions in cold dishes. If you prefer to add onions to cold dishes such as salads or appetizers, the best way to maximize the benefits is to slice them just before serving. Onions lose their nutritional properties quickly once they are sliced, so it's best to prepare them shortly before eating. If you do decide to slice them ahead of time, store the onions in an airtight container in the refrigerator, but not for more than a day. To reduce the harshness and sharpness of the flavor, you can soak the onions in ice water for 10 to 15 minutes before adding them to the salad. Not only will this soften its flavor, but it will also retain its crunchy texture. Step 4. Dosage and frequency of use. Equally important is how often and in what quantities you consume onions. You can use onions as part of your daily diet, but it's important to use them in moderation. For example, a daily serving of onions of about 50 to 60 grams is an ideal balance that provides enough antioxidants, vitamins, and fiber without risking the gastrointestinal tract. Moderation is especially important for people with sensitive stomachs or a tendency to heartburn. If you find that onions make you uncomfortable, try reducing the amount or substituting a raw version for a cooked one. This often helps. Step 5. Combinations with other foods. Onions become even more beneficial when combined with other foods. For example, if you add it to dishes rich in vitamin C, such as peppers or cabbage, it enhances its antioxidant effects. Onions also pair well with foods that contain healthy fats, such as olive oil or avocado, which helps in better absorption of its benefits. One of the most interesting ways to use onions is to add it to your diet. Is to combine them with garlic. Together, these two foods form a powerful natural complex that supports the immune system and helps strengthen the heart. Step 6. Proper storage. In order for onions to retain their beneficial properties for a long time, it is important to store them properly. Never keep onions in plastic bags. This will lead to rapid rotting. The ideal place for storage is a cool and dark place with a temperature of about 10 to 12 degrees Celsius, 50 to 53 degrees Fahrenheit. This can be pantries or lower shelves of closets where onions can rest and retain all their useful properties for several months. Also remember, sliced onions, as I mentioned above, should be consumed as soon as possible. In an airtight container in the refrigerator, it can be stored for no more than 1 day, after which it begins to lose vitamins and antioxidants. Conclusion: onions, like any other natural food, require respect and an informed approach. It can be a true ally in the promotion of health, if you approach its use wisely. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos. Maintaining kidney health is crucial for overall well-being. These hard-working organs clean our blood, balance fluids and electrolytes, and produce essential hormones. But, in our busy lives and unhealthy lifestyles, we often forget to take care of them, which can damage them or lead to their diseases. But don't worry. You can heal your kidneys and improve your health just by eating some foods. Yes, that's true. Diet plays a crucial role in maintaining optimal kidney health, and what you eat can either stress or help your kidneys. In this video, we will share 8 essential foods that are packed with nutrients, which can help you in healing your kidneys. So, let's begin. Number 1. Bitter melon. Bitter melon is an edible fruit that is cultivated worldwide for its unique benefits. It is highly valued in traditional medicine, particularly in Asia, Africa, and South America, for its numerous health benefits, including potential improvements in kidney health. It contains antioxidants including vitamin C, vitamin A, zeaxanthin, and lutein. These antioxidants help combat oxidative stress throughout your body, including in the kidneys. Oxidative stress is basically an imbalance between free radicals and antioxidants in the body, leading to cell and tissue damage. It can cause scarring in glomeruli, the cleaning units of kidneys, damaged kidneys, and can be a major contributor to various kidney diseases. So, by combating oxidative damage, bitter melons can help you heal your kidneys and maintain their healthy function. Bitter melon can also help kidneys by regulating blood sugar levels. This is due to its compounds like cheratin, visine, and peptide P. These compounds can improve the utilization of sugar in your tissues and increase the secretion of insulin, a hormone responsible for regulating blood sugar levels. High blood sugar levels can damage the blood vessels in the kidneys over time and lead to diabetic nephropathy, a form of kidney damage. By helping to manage blood sugar, bitter melon can protect your kidneys from diabetes-related damage. Many studies also have confirmed bitter melon's role in regulating blood sugar levels. In fact, a study involving 40 people showed that consuming 2,000 mg of bitter melon every day for 4 weeks regulated blood sugar levels efficiently. Bitter melon also possesses anti-inflammatory properties, which can be beneficial in reducing kidney inflammation and slowing the progression of certain kidney diseases. Because chronic kidney disease and other kidney-related ailments often involve inflammation, so, by managing inflammation, bitter melon can prevent and treat kidney damage. Moreover, a study also found that bitter melon has a preventive effect against kidney damage caused by methotrexate, a medicine used to treat different diseases. But, that's not all. Bitter melon can also help you lower bad cholesterol, LDL levels, a risk factor for kidney diseases while increasing good cholesterol. When it comes to how to incorporate bitter melon into your diet, you can eat it both raw and cooked, or you can also opt for bitter melon powder capsules. However, raw melon can be bitter and difficult to eat, so prefer other methods. Moreover, remember that while bitter melon offers numerous benefits for kidney health, use it with caution, because consuming bitter melon in excessive amounts can lead to adverse effects due to its potent bioactive compounds. Number 2. Flax seeds. These tiny seeds are loaded with many beneficial nutrients, which make them an excellent choice for you to support kidney health. Firstly, they contain omega-3 fatty acids, especially a type called alpha-linolenic acid, ALA. These fatty acids help reduce inflammation and can heal your kidneys. Secondly, flax seeds contain fiber and lignans. These two nutrients along with fatty acids can contribute to improved heart health and can lower bad cholesterol. Both of these benefits are closely linked to kidney health because a healthy heart and lowered bad cholesterol can ensure healthy blood vessels and proper blood flow to the kidneys. Moreover, flax seeds can lower blood pressure, a significant benefit because high blood pressure can exacerbate kidney issues, as it can affect the blood supply to your kidneys, affect their efficiency, and damage them. Adding flax seeds to your diet is easy and delicious. Sprinkle them on your cereal, blend them into smoothies, or mix them into yogurt. If you enjoy baking, add ground flax seeds to bread, muffins, or cookies for a health boost and a pleasant nutty flavor. Eat 1 to 2 tablespoons. 7 to 14 grams of ground flax seed per day. It appears to be a reasonable and safe dosage to support kidney health. However, it's important to introduce flax seeds gradually into your diet due to their high fiber content, because it can cause digestive discomfort. Moreover, do not consume flax seeds with other high-fiber foods like bran or psyllium husk, as this can also lead to digestive issues such as bloating and gas. You should also keep in mind that excessive intake of flax seeds alongside blood-thinning medications or supplements like aspirin or warfarin can increase the risk of bleeding due to their omega-3 content, which has blood-thinning properties. Number 3. Turmeric. Turmeric is a yellow spice widely used not only to enhance the flavor of food, but also for its health benefits. The primary compound responsible for these benefits is curcumin, which gives turmeric its distinct color. Curcumin has antioxidant properties, particularly beneficial for maintaining kidney health because it can help combat inflammation and neutralize free radicals, providing significant protection to your kidneys. Studies also indicate that curcumin can support the health of blood vessels by reducing inflammation and oxidative damage in them. Healthy blood vessels are essential for regulating blood pressure and preventing blood clots, both of which are vital for kidney health. Moreover, curcumin can also reduce the amount of protein in the urine, a common indicator of kidney disease, thus contributing to better kidney function. Incorporating turmeric into your diet is simple and can make meals more flavorful. Add it to smoothies, soups, and curries. You can also create a delicious drink, known as golden milk, by mixing turmeric with milk, dairy, or plant-based, and a bit of black pepper, which enhances the absorption of curcumin. For general kidney health, opt for 500 to 1,000 milligrams of turmeric per day. This equates to about 50 to 200 milligrams of curcumin per day. For those with chronic kidney disease, the dosage should be on the lower end, around 500 to 1,000 milligrams of turmeric per day, 50 to 100 milligrams of curcumin. Higher doses may potentially worsen kidney damage. Moreover, while turmeric is highly beneficial, it can be a bit problematic when combined with certain foods or medications. For example, combining turmeric with blood-thinning foods like garlic, ginger, and ginkgo biloba can increase the risk of bleeding. Similarly, pairing turmeric with high oxalate foods like spinach and beet greens can raise the risk of kidney stones in susceptible individuals. Number 4. Fish. Fish is an excellent source of high-quality protein. This protein can help in tissue repair throughout your body, including kidneys, and can support overall kidney health. So, when you eat fish, you're not just enjoying a tasty meal, but also supplying your kidneys with essential building blocks for optimal performance. Moreover, certain types of fish, such as salmon and mackerel, are rich in omega-3 fatty acids. These fatty acids act as a defense against inflammation, a major factor contributing to kidney damage over time. These omega-3s can also enhance blood flow, ensuring your kidneys can efficiently filter waste and perform their crucial functions. Moreover, another advantage of fish is its naturally low content of saturated fats. This makes it a heart-healthy choice that can indirectly benefit your kidneys. Eat 2 to 3 servings of oily fish like salmon, mackerel, or sardines per week for improved kidney health. However, it's important to be aware of harmful food combinations with fish. For example, combining fish with foods high in oxalates, like spinach and beets, may increase the risk of kidney stones in susceptible individuals. Number 5. Olive oil. Olive oil is packed with antioxidants like vitamin E and polyphenol. These antioxidants, like other ones, can reduce oxidative stress and inflammation, which are major factors in kidney damage. They can also protect your kidneys from further damage. Olive oil also has monounsaturated fats, which can reduce bad cholesterol and lower high blood pressure and can contribute to healthy kidney functioning. Moreover, it is also phosphorus-free and is a kidney-friendly food. When it comes to how much olive oil you should consume, it depends on your individual calorie needs and dietary restrictions. A general recommendation is to use olive oil in place of other fats, limiting total fat intake to 25 to 35% of daily calories. However, it is important to be mindful of combining olive oil with foods high in sodium or processed sugars, as this can counteract its health benefits and potentially harm the kidneys. High sodium intake can elevate blood pressure, while excessive sugar can lead to diabetes, both of which negatively impact kidney health. Number 6. Blueberries. Blueberries are small fruits, but their benefits go far beyond their size. They are packed with antioxidants, especially anthocyanins, which give them their distinctive deep blue color. As mentioned before, antioxidants play a crucial role in combating oxidative stress and inflammation, both of which are leading causes of kidney damage. They also contain vitamin K, which can promote heart health and help in improving kidney health. This is because a healthy heart ensures smooth blood flow throughout the body, including the kidneys. This efficient circulation can help the kidneys filter out waste and harmful substances more effectively. Moreover, blueberries are also low in sodium, phosphorus, and potassium. A half cup of blueberries contains less than 150 milligrams of potassium. This makes them a kidney-friendly diet, as these minerals will not stress your kidneys. Moreover, an 8-day study involving obese people at risk of heart issues found that consuming 2 ounces 50 grams of frozen dried blueberries reduced their BP by 4 to 6%. This reduction in BP is also good for the kidney, as high BP can damage kidneys and nephrons and is a risk factor for kidneys. Another remarkable benefit of blueberries is their potential to prevent urinary tract infections, UTIs. UTIs can lead to serious kidney infections if left untreated. The special compounds called proanthocyanidin in blueberries may prevent bacteria from adhering to the walls of the bladder, reducing the risk of UTIs. This is particularly beneficial for individuals with kidney issues as it lowers the likelihood of additional complications. So, aim for 1 to 2 servings of fruit per day as part of a kidney-friendly diet. While blueberries are generally safe and beneficial, do not combine them with certain foods. For instance, Mixing blueberries with dairy products like milk can sometimes reduce the effectiveness of the antioxidants in blueberries. Number 7. Cabbage. Cabbage is a green leafy vegetable enjoyed in many cuisines around the world. It's not only delicious, but also beneficial for health, particularly for kidney health. It is loaded with antioxidants like vitamin C and sulforaphane. These antioxidants combat oxidative stress and reduce inflammation throughout your body, including the kidneys. This can heal damaged kidneys and even protect them from further damage. Cabbage is also rich in fiber, which can aid in digestion and help your kidneys remove excess waste and fluids. Moreover, cabbage is low in potassium, and this makes it a kidney-friendly diet, because impaired kidneys may struggle to remove excess potassium and become stressed. Moreover, potassium levels may exceed in the blood and cause many other health issues. So, cabbage is an excellent choice because it contains low levels of potassium. There are many easy and tasty ways to incorporate cabbage into your diet. It can be eaten raw in salads and slaws, fermented to make sauerkraut or kimchi, or cooked in soups, stews, and stir-fries. These various preparations make it simple to enjoy cabbage's health benefits regularly. To fulfill the recommended dosage, eat about half a cup of cabbage 5 days a week. However, be mindful of certain food combinations that can be harmful. Cabbage, when combined with high-sodium foods like processed meats or canned soups, can lead to increased blood pressure and negatively impact kidney health. So, pair cabbage with fresh, whole foods to maximize its health benefits. Number 8. Cucumbers. Cucumbers are very nutritious fruits, and they can help you in healing your kidneys in different ways. Firstly, they are naturally very high in water and have diuretic properties. This keeps your kidneys hydrated and increases urination. Increased urination can help your kidneys flush and remove excess fluid and waste buildup from the body, and will improve kidney functioning. Secondly, they are packed with antioxidants, including vitamin C and beta-carotene. These antioxidants can combat harmful free radicals, causing damage and act as protectors for your kidneys. They can also reduce inflammation naturally. As discussed before, oxidative stress and inflammation are often risk factors for kidneys, so by managing them, cucumber can help in healing your kidneys. Thirdly, cucumbers are very low in sodium, which is excellent for healing your kidneys and maintaining their health. This is because low sodium will not stress out your kidneys and it will lower your blood pressure. Blood pressure is a major risk factor for kidneys because it can damage blood vessels, reduce blood supply to kidneys, and damage nephrons, the filtering units of kidneys. Moreover, cucumbers have potassium, which can also help in regulating blood pressure. In this way, cucumber can help in improving kidney health. Cucumbers also have alkalizing properties and can help maintain the right pH in your body, which is vital for your kidneys to function effectively. Moreover, cucumbers are low in phosphorus and potassium, which makes them a kidney-friendly diet as these minerals will not stress your kidneys. You can eat them without concern. When it comes to how to incorporate cucumbers into your diet, add them to salads, enjoy them as a snack, or infuse them in water for a refreshing drink. Aim for at least 1 serving of a medium cucumber per day as part of a balanced diet. However, do not consume too many cucumbers along with high potassium foods like bananas or avocados, because it can lead to an imbalance in mineral levels, which could be problematic for those with kidney issues. If you like this video, give us a thumbs up and share it with everyone you care about. Thanks for watching and see you in the next video.